Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all that ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm really pleased today. My guest is Ron Emerson. Ron is the global healthcare lead at Zoom. Ron, welcome to the Tate Chronicles.
Thank you very much, Jim. Thank you for having me.
Ever since, we're a little over 2 years into the global COVID pandemic. And so I've been wanting for 2 years to talk to somebody at Zoom. So thanks for sitting in the guest chair today.
It's an honor to be here, and I look forward to speaking with you about what we've experienced and what we see coming in the future.
Ron, one thing I was interested, I was looking at your background a little bit, and you and I have pretty similar backgrounds. We both were in healthcare delivery. I see you have a clinical background that includes home health and nursing facilities and other domains that span healthcare. And then after that background, which the solid footing and foundation, you moved to the technical side with telehealth and telemedicine.
That's correct, yes.
And so Zoom and telehealth, prior to the pandemic, I don't even know if this is a question that has an answer to it, Ron, but prior to the pandemic, in terms of Zoom meetings, how big a percentage or slice of the pie was the healthcare side of Zoom?
Yeah, that's an interesting question. I mean, the exact number I'm not really able to give out to specific percentages.
Sure.
But I can tell you that Zoom has been involved and has been deeply vested in healthcare since 2016. Since 2016, just to use the U.S. as example, we've provided a business associate agreement to enable organizations to assist in their compliance programs for HIPAA. And we've just continued to grow. And of course, with the hyper digitalization of COVID, we've even taken it to different levels.
I remember so well, probably, I guess it was the third week of March in 2020, when literally in a 3-day period, every ambulatory practice in the United States shut down. And all those providers had to figure out some way to communicate with patients other than in the analog face-to-face concept. They had to come up with some solution, not only to provide care, but the fact that they couldn't bill. There was, if they weren't having patient encounters on some level, it'd be an incredible financial hardship. And of course, the federal government declared the health emergency and provided parity, at least for temporary purposes, between virtual visits and in-person visits. And those providers really only, had less than a week to find something and start using it. And I'm sure the vast majority had never used any type of telehealth platform.
No, that's true. And of course, Zoom was really honored and proud to be the solution of choice for a lot of healthcare systems. And everything from big centers of excellence to smaller practices is a way for them to reach out and interact with their patients. And I think an interesting number on that point, Jim, that, and this, of course, is going back to when the beginning of the pandemic, which, of course, you're referring to, is if you look at December of 2019, Zoom had about 10 million daily meeting participants. And then if you go to April, let's say around close to 4 months later, Zoom had about 300 million daily meeting participants. So it just shows you the hyper acceleration of the use of the Zoom platform. And of course, that trajectory was equivalent in healthcare as well. And that's why Zoom is actually still to this day, 9 out of the top 10 hospitals in the world ranked by US News choose Zoom. And a lot of that is for their virtual care, direct-to-consumer telehealth practices.
One of the things that kind of surprised me is that, of course, I believe we still have parity for those providers who are doing patient visits using technology such as Zoom. I know there's a big push to continue that. I think it certainly has not been finalized yet, but providers certainly were able to jump on board, figure out how to use Zoom. Just in the healthcare setting, we're not even talking about the broader setting of all the other domains that these meetings started taking place virtually in. But the ability to get patients to be able to handle their side of the technology so that they could do a Zoom visit with their provider. I'm sorry, something you want to say about that, Ron?
No, I was going to say, just to jump on your point, I mean, a couple of things is, yes, the patients, the Public Emergency Act, of course, is still in place for the U.S., and it was basically just passed, the omnibus bill was passed that 5 months after the Public Emergency Act actually ends, we will still have the same reimbursement as we have during COVID, right? During the Public Emergency Act. So we do have some runway. Zoom has been a real proponent of supporting legislation that's going to help sort of carry on a lot of the same reimbursement, so we can still provide and use our platform and do what's best for American citizens, which is provide access to care. We know there's a correlation between quality of care and access to care. And our biggest push has been with the Connect Health Act of 2021. And, it has a lot of bipartisan support, the Senate and the House of Representatives. And I think what's exciting about this is as we look at sort of the next steps of telehealth, Jim, is that during COVID, Zoom actually did a study with Qualtrics, and it's an organization that does that. And when we looked at patients who had actually received a virtual care visit within 6 months, 61% of them said that they wanted a hybrid model of care. Basically, let the actual clinical situation or the level of interaction needed with the healthcare provider dictate what kind of interaction you needed. Do you need to go in person? Can you do it over video? Are you doing a follow-up where you're getting results? So we just see so much promise in telehealth as far as being able to provide the access that's needed, and then just to help increase efficiencies that are much needed within our healthcare system.
The technology around telehealth or telemedicine or whatever it's being called these days, the technology has pretty much been in place for a few years, but maybe it is the silver lining of the COVID pandemic, at least in the U.S., that technology was on the shelf and people could pull it off and immediately start using it. It would have probably taken the adoption of these technologies for sure would have been much, much slower, but all of a sudden people had to figure out how to use it. And just the workflows within a practice whether somebody is triaging calls or if there are a number of patients maybe waiting in like Zoom has the waiting room where people are allowed in to see the provider in certain sequence, things like that, the scheduling of all that stuff. Everybody had to figure that out. And for the most part, it did get figured out really quickly.
It did. Yes. It's interesting. I mean, you bring a good point. I mean, I think at one point, if you look pre-COVID, and this, we know this from self-insured employers, it's very well documented, and from insurance companies, that people that could see their clinician over, let's say, their phone or whatever in their home, because it was reimbursed, the utilization rate was less than 3%, kind of across the board. And then, of course, to just decrease exposure to the actual virus itself, we saw with some of the centers of excellence that we work with that the actual rates were up to 75 to 90% of all outpatient visits were actually be done virtually. So we were sort of thrust and pushed into this sort of hyper digitalization and the virtualization out of necessity. But what's been interesting is sort of what's coming out the other end, right? And we're not through COVID yet, but what does life look like? And just because of that, it's just not about telehealth, which I think is really important, Jim, to really bring out here. We see such a move. We see different care delivery models, which is the virtualization of care, which is telehealth and seeing a clinician on a phone. And you got to remember too, when we talk about reimbursement in the Public Emergency Act, that's just for Medicare. Medicare is about 16% of people in the United States. It's over 20-something% of the spending, of course, because it's 65 and older,
Sure.
But still, state Medicaid's reimbursed. A lot of the private's reimbursed. We have state legislative mandates that providers have to that payers have to reimburse within certain states. But what's going to happen after? And we're still seeing a very strong trend. Some of the numbers that I've seen is 18 to 17% of outpatient visits are actually being continuing to be done virtually. And I met with a hospital, last week that they're still around 19 to 21% of all their out, and they have about 13 hospitals. So it's exciting what the opportunity has to hold.
Ron, we've kind of spoken so far about the provider to patient use of Zoom healthcare. What about provider to provider as well as care team meetings? What kind of use cases have you been seeing around that?
Yeah, it's a great point. And, one of the things that I'm really excited about, and we look at Zoom every day is, I think, we've both been in healthcare for a while, as you said earlier, Jim. And if you look at from, 1960 to 2010, I mean, if you, the cost of healthcare increased 5 times of what gross domestic product did, right? And we were mostly on a fee-for-service basis. We're starting to move more towards value-based care. About 2020, 35.8% of Americans were underneath some sort of alternative payment system. So it's not just about the clinician or the doctor or the provider seeing the patient. It's about the care team, right? Under capitated rates, like the hospital gets so much money per month to take care of the patient, or kind of the whole HMO model, PPO, but it has more teeth to it now. So those use cases specifically based on those models are like multidisciplinary team meetings, right? Where you have different experts from a variety evaluating one case to make a clinical decision based on a variety of different applications. And I actually have a personal experience. I have a family member that had a arterial venous malformation. I live in the state of Maine, and it was in her brain, and didn't realize it until 30s and started having some issues, right? And we went, and I live in the state of Maine, went to a local neurosurgeon in the state of Maine. And what do you think a neurosurgeon wanted to do? He wanted to operate, right? And if he would have operated, it would have left hemiparesis on the left side of her body. So the left side of her body for the rest of her life, she would have had mobility issues. And, we don't know how significant. So I was blessed enough, that I'm able to afford to go down to Boston, one of the leading centers of excellence in the world. And we saw a multidisciplinary team meeting. And they made a decision with neurosurgeon, radiation oncologist, neurologist, and basically what they said is that would have been one of the most horrible, just egregious things that we would have seen, that they did proton radiation therapy, and she's fine as of this day and has full mobility and has just lived her life ever since. And that's been over 20 something years since it actually happened. But the reason I bring it up, the example that I just gave, Jim, that exact same care and access could have been provided over Zoom video technology, where using PAC systems, they could have shared the imagery back and forth. They could have had the interaction. They could have interviewed her, done a physical exam from a distance with their provider, and they could have still had that multifunction. That's one application. Provider to provider continues to happen. Better care coordination, better discharge planning, tumor boards. One of the areas we're seeing a lot of use of the Zoom platform, as I said, it's these different payment models, wellness and prevention. How do we get people vested and interested in their own care and their own health? And I think we're realizing, from the old HMO PPO days, it's not sending a brochure in the mail. It's about having high level, impactful communication. And that's what Zoom does, right? And having that ease of use. So we're seeing uses in those areas as well.
Well, one question that always comes up is around the issue of HIPAA. Can you tell us about, HIPAA and using Zoom for telehealth?
No, of course. Yeah. I mean, Zoom's, as I said earlier, Zoom we work under, and of course, adhere to the Office for Civil Rights 45 administrative privacy, physical and security safeguards. And then we match against those. And then, of course, we have an outside organization come in, and a third-party organization come in, and then we get an attestation. So the Zoom platform as a whole is underneath that business associate agreement. So Zoom Phone, if you're doing recordings, Of course, data at rest and data in motion, all that falls under the business associate agreement. There's a couple little nuances to that. One is reduced, which we're very proud and really happy to announce, and we just announced it in HIMSS. It's called the Zoom Contact Center. In the Zoom Contact Center, it's think of it as any other contact center, a phone contact center where you can do skill-based routing. Of course, you can do queuing, all the things that you would expect. But the big difference with Zoom is that it actually has video capabilities. And there's some. Just read a report the other day that said that 65% of organizations, and there was over 1,800. It wasn't just healthcare, but they believe that some sort of virtual or visual engagement with their customers is very important. So we're seeing this move towards visualization. So our contact center actually has the visualization piece for telehealth and other things, but it also has the traditional phone call center capabilities. So that is a regulated market, and that is not covered as of yet, but that will be coming soon. And then we have some whiteboard technology as well. But besides that, when you get a BAA with Zoom, the platform is covered, and the entire platform is covered under the business associate agreement with Zoom.
One thing that was a problem early on 2 years ago when a lot of patients were trying to have these telehealth visits with their providers is they were using applications, third-party applications that required them to download an app and configure that app. Does Zoom Healthcare, the Zoom platform, allow a provider just to basically send a link, and then the patient can really run the session in a browser window?
Yeah, there's two different ways. I mean, one is we do prefer the app. I mean, there's organizations like Zoom exist for a reason, right? And if someone can use the app, especially if it's more of a longitudinal relationship, like if it's psych or something, then it makes a lot of sense. We do have, and we've run it through beta, and we announced it a little while back. We do have a browser-based WebRTC version where you can send someone a link and they can click on it, and it'll actually open up where they can do that interaction through their browser on their phone to make it easier.
Okay.
But then again, though, we have some other technologies where you can do a pre-test. So if you do the app, you can do a pre-test ahead of time so the technology is ready. And it's always that, it's always that choice of, okay, do we take the extra time to get all the benefits that Zoom provides, which others don't, is to be able to work better in low bandwidth environments, the ease of use, the actual experience itself. And that's why so many folks use Zoom, compared to just making it easier to connect the call, right? But then you don't have as good of audio quality. Maybe the video call, there's a lower success rate of the video actually working and the audio working. So organizations are sort of, trying to figure out where those lines are. We do offer both. When you download the app, if you have the app, it'll just basically, this is only for healthcare, Zoom provides this. If you do have the app, it will actually, it'll of course just default to the app. And if you don't, then you could use the browser version if you choose to.
Sure, that's helpful. Another thing I wonder about, use cases where you see maybe a provider sets aside one afternoon a week to do virtual visits with patients. How do they, on the provider side, handle the scheduling? Are there some third-party things they have, or does Zoom have some type of scheduling feature?
Yeah, there's a couple ways they can do it. I mean, you can use, well, first of all, Zoom, we really pride ourselves on our integration capabilities, APIs and SDKs. And, just to talk about some of the volume, Zoom is embedded into Epic, right? And during the height of COVID of August of last year, during the height of COVID, our top 100 integrations into Epic, we actually had almost 3 million consults in 1 month. And the way that would work is the patient goes into my chart, they schedule their appointment, they pick their time, they put why they're going to be seen, they have e-commerce, they can actually pay with their credit card. It automatically schedules it on the doctor's side. It's in their schedule that it's a video call. The doctor clicks on it during the time of the consult. They can still type in the patient's chart while they're talking to the patient and interacting with the patient. and the patient goes into the my chart portal on the other side. That's one way you can do it. We also just finishing up with Cerner for integration into Cerner, and we're in beta right now with that. Really excited about that. And then we work with a number of telehealth solution providers that use Zoom as their video engine to drive that high level interaction. But then some, Jim, just very open. They just decide to use Zoom as it is. They use their traditional model. Someone calls in, they talk to a receptionist. They basically get the email of the patient. They hit a button. They have a pre-canned instructions on how to test the technology. The message goes to the patient with the time of their actual consultation and visit. It automatically, they put the link in the patient's and the physician's calendar, and boom, they're off and running. And we see some organizations doing up to 40,000 consults a month using that method. So we can use APIs and SDKs and integration workflows, which we do quite frequently, but then also other organizations would rather just use Zoom out of the box. And I see Zoom as almost and I think COVID proved it is, that's why Zoom has been so successful, Jim, is this is simplicity, right? The simplicity, the ability to work in low bandwidth environments, the ease of use. And I think it was, almost seen as in the past as almost too simple for telehealth, but now we're a real, kind of front runner and market share leader in the telehealth space. And because we have the return on investment and our, current model, and to your question, is we believe that there's enough technology out there. Organizations aren't looking for additional technologies and workflows. They want to use the same workflow that they use every single day in their day-to-day practice in person. So what we want to do is we want to enable you to just use our virtual tools as Zoom as it is, or integrate into that same workflow so you can mimic what you do every single day. And that's our strategy. And it's been very, very positive and worked well for us.
One successful use case I've heard of recently, I was talking to a director of a home health agency yesterday. And of course, to get Medicare billing, there are a certain number of required in-person visits, but also they get calls from their patients to check on them or exchange some information about some device they have that seems to be on the fritz or something like that. And rather than send a person out, they're able to, handle that just with a telehealth call.
Exactly.
So there's so many use cases out there. And I know you mentioned the ability to exchange files, like where some files are too large. A radiographic DICOM image is too large to move easily at all. But there are a lot of, smaller files that I believe is correct. You said could be moved during the actual encounter.
Oh, 100%. You could use it during the encounter, or you could send that over Zoom, like an image of a lesion or something. You could send it before the encounter because, like I say, data in motion and data at rest is under your business associate agreement. And then you would have that information. And then when the actual consult happened, they could refer to it. Because, when you look at reimbursement in general, reimbursement, what triggers that is that live interaction. And as we move out of the, the Public Emergency Act, a lot of the regulations that you're most likely going to see, not definitively, but you're going to see is that it does have to be a live interaction and a video interaction between the clinician and the patient. So there's just many different ways, and the creativity is there. But I think across the board, though, Jim, the thing to really get excited about, and I just is the clinician. Zoom is the market share leader. More people saw their clinicians. Definitive Healthcare, they evaluate hospitals and they have Zoom as the market share leader in all of their analysis. And then like the American Academy of Family Physicians, they also had Zoom as for smaller clinicians and practices, had Zoom as the market share leader during COVID. So we're very proud of that. And we really are doctors seeing patients in that. But we see that as being very critical and important. But as I said earlier, it's about all of the other things, the wellness and prevention. It's about care coordination. It's about better discharge planning. It's about the patient-centered medical home and being able to coordinate across, because we know all of those things provide clinical outcomes. So it's going to be the entire care team that's going to be able to need to connect with the patient, regardless of where they're located in that continuum of care, right? And, the hospital and the home, we're really excited about the movement in that area.
That's giant.
That's all about communication, right? I mean, you have and when I was working my way through college after I got out of the Marine Corps, I worked for a biomedical company, and, we had home oxygen concentrators and
Sure.
set up CPAPs and BiPAPs, and we'd have, IV pumps and all that. And so when you think of the hospital at home, it's basically the same thing, right? But how do we connect to those resources, those clinical and technical resources to provide the support? And of course, we really see what Zoom does as being a key component of being the communication backbone to keep those programs up and running.
Ron, it's hard to believe, but we're almost totally out of time.
Wow.
But one thing I want to check with is if listeners want to know more about the healthcare solutions offered by Zoom, best thing to do is maybe just Google Zoom and Zoom Healthcare.
Yeah, just Zoom Healthcare, and it'll bring you to the healthcare portion of our webpage. Some things we do for small practices. We actually have an online, they can buy a single license and get an automatic BAA digitally signed. Like I say, we want to make it easy for all levels and sizes of healthcare organizations to have access. And then you can also just hit a little button there that says contact us, and we'll have someone get a hold of you.
Great. Well, thanks for our audience for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Ron Emerson of Zoom Healthcare. Ron, thanks for coming aboard today.
I really appreciate it, sir. You have a wonderful day, and thank you for your time.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.